Hello, good morning, good afternoon, good evening, depending on where you are. My name is James McFarlane. I'm a special project manager at Cantabria Labs. And on behalf of Cantabria Labs, I'd like to welcome you to the In Touch webinar. This is the first in a series of webinars making up the Cantabria Labs In Touch program, where we will learn, share, and experience science together with leading international experts in dermatology, focusing on issues of interest and importance for the medical and dermatological community. We are very fortunate to have with us today Dr. Zoe Draelos, who will update us on her famous skin health and beauty pyramid. And I would like to ask Dr. Maria Vitale, Medical Director of Cantabria Labs Dermatology, to introduce her. But before doing that, just very briefly, a few rules for the session today. Obviously, as you know, we are in streaming, so you don't have to worry about the video camera, about the microphones or anything like that. Just relax. If you'd like to ask questions, there is a box on the right-hand side of your computer screen where you can write your question, send it to us during the presentation or after the presentation. And so without much more ado, Maria Vitale, would you like to introduce yourself and Zoe Draelos? Thank you.
Thank you, James. I am Maria Vitale from Cantabria Labs, and really is an honor to introduce Dr. Zoe Draelos today. She has an impressive curriculum that I try to summarize a little bit. Dr. Draelos is US Research and Clinical Board Certified Dermatologist. She is a consulting professor of dermatology at Duke University, and she is author of 14 books and more than 500 publications. Amazing. Welcome, Dr. Draelos, and please go ahead with your presentation.
Good morning and good afternoon, depending upon where you are. I'm thrilled we have this time to spend together. I thank you very much, James and Maria, for that kind introduction. For the next 30 minutes, we'll be taking a deep dive into the skin health and beauty pyramid. I think this is a very important tool that will help you organize your cosmeceutical recommendations to your patients. It'll also help you organize a treatment regimen that you can use with patients in order to optimize their cosmeceutical treatments and other aesthetic treatments. I would like to disclose that I was a consultant for Cantabria Laboratories, which is the sponsor of this symposium. So how exactly do you develop and organize a skincare routine for your patients? Patients are always looking for dermatologist recommendations on how to optimally care for their skin. There are many choices available for anti-aging moisturizers and serums, and it can be challenging, not only for the patient, but also for the dermatologist. The dermatologist really needs to guide the patient to help them navigate this complex commercial world of over-the-counter products for purchase. But organizing all of this into a pyramid can be very helpful in addressing all the aspects of anti-aging, all the products that are currently available. And this will allow you and your patient to have a logical regimen of recommendations and products that can be applied. Now, I actually worked on the original Skin Health and Beauty Pyramid about 7 years ago, and this was published in the Journal of Drugs and Dermatology. But in the last 7 years, tremendous advancements have been made, and these advancements in skin physiology have translated into better cosmeceuticals that now offer more and better options for your patients. This is the new Skin Health and Beauty Pyramid, with the base being protection, the middle being renewal, and the top being activation and regeneration. What I'd like to do is take you through each of the steps of the pyramid. We'll start at the bottom. Those are the foundational products. Then we'll add the middle, which are the renewal products. And finally at the top, activation and regeneration. When you think about a pyramid, you have to think about the fact that the bottom is the stability, and it's broader. And this is something every patient should use. And then you build on that as you go up the pyramid by making recommendations that are cohesive and coherent for your patient. Now, at the bottom of the skin health and beauty pyramid are all the external aggressive factors. Some people have called these part of the exposome. So we know that high temperature and heat can prematurely age the skin. We also know that the blue light that's emitted by phones and computer screens and other digital media can damage especially the back of the eye or the retina. And we also know that this blue light can precipitate macular degeneration as well. Tobacco, anything that burns, pollution, the same thing, anything that's combusted results in the production of nanoparticles. These nanoparticles can reside and form on the skin surface, and as they fall from the atmosphere onto the skin surface, they create reactive oxygen species. We also know that sun radiation can damage the skin, not only ultraviolet A and ultraviolet B, but also visible light and infrared. Finally, there are a variety of bodily processes that can also be optimized or degraded. For example, insufficient sleep is sure to result in increased bodily stress and offset of the hypothalamic pituitary axis. Stress can also have hormonal influences on estrogens, on testosterone, as well as the endogenous release of cortisol. And finally, nutrition. Eating a vitamin-rich diet that provides all the necessary antioxidants for your skin is very important. A diet that's devoid of these vitamins, for example, fried chicken and French fries, isn't going to provide the vitamins that you need for healthy skin. Thus, addressing all of these areas of protection is important because all of them have one thing in common, and that is the generation of reactive oxygen species. Now, in order to think about the bottom of the pyramid and protection, all of the products that are in that category need to go into a moisturizer. The moisturizer, if you will, is the vehicle for most cosmeceuticals that brings the product to the skin. The moisturizer can have benefits of its own, but the moisturizer also acts as a carrier to deliver whatever the cosmeceutical active ingredient may be to the skin in an intact form, in sufficient form that it can have a physiologic effect, and in a form that's also aesthetically pleasing. Here we see the brick and mortar model of the stratum cornea. This is the picture of beautiful skin, where the lipids, the intracellular lipids, encompass each of the protein-rich corneocytes, and those lipids are ordered and covalently bound on the surface of the corneocyte. It is this brick and mortar, where the lipids are the mortar and the corneocytes are the brick, that accounts for beautiful, healthy skin. A cosmeceutical moisturizer is designed to create an optimum environment for healing and restoration of the skin. Thus, moisturizers are probably the first step in protection and preservation of the skin. Now, under protection, we have the use of SPF products to protect from the sun. We have antioxidants and actives to protect and repair, which are ingredients that protect against pollution. Let's now take a deep dive and take a look at this protection, which is the basic fundamental bottom of our skin health and beauty pyramid. Sunscreens are of utmost importance, and I think we as dermatologists know very well that sunscreens are the foundation of any skincare regimen. Recommendations are from the American Academy of Dermatology that everybody wear a sunscreen when the SPF of 30 or higher. Sunscreen containing facial moisturizers can be used for individuals that are working outdoors or not sweating, and they should be daily, providing protection against UVA, UVB, infrared, as well as visible radiation. Water and sweat when you're out of doors, of course, will rinse away a product that is not water resistant. Selecting a water resistant outdoor product is critical when you're going to be out of doors, and they should be reapplied every 2 hours or after each water contact. The best sunscreens contain a variety of filters, and those filters should be organic filters, such as the salicylates and cinemates that undergo a chemical reaction when a photon of UV radiation strikes them. The problem with organic filters, however, is that they get used up. As one photon of light strikes the sunscreen filter, causing resonance delocalization, that molecule can no longer act again. But inorganic sunscreens that do not undergo chemical change such as zinc oxide and titanium dioxide, have greater longevity in the sun. Of course, both of these are minerals, and they absorb but largely reflect UVA and UVB. Thus, because they are inorganic, they do not undergo a chemical reaction. And the best combinations are to use an organic and an inorganic sunscreen together. By combining both of these, you get a sunscreen that has great longevity and excellent sun protection. Now, unfortunately, sunscreens do not get all of the oxygen radicals that are formed in the skin. If, for example, the sunscreen isn't an even film, there's a skip area, or if the sunscreen has been sweated off or wiped away, there may be areas of the skin that are going to still be susceptible to UV damage. Antioxidants may be helpful in this realm. Antioxidants really don't contribute to the SPF of the product, but they can be inactives that can be very helpful or can be applied as separate products outside of sunscreen use. Antioxidants basically quench oxygen radicals by donating an electron to the oxygen radical, resulting in stabilization. So, for example, in the skin, the primary antioxidant is vitamin E. Vitamin E has an extra electron that it donates to the reactive oxygen species, thus quenching it. However, once vitamin E donates that electron, it has no more to donate. Where do the further electrons come from? Because vitamin E is fairly hard to eat in the regular diet. Well, it comes from the secondary antioxidant, which is vitamin C. So now vitamin C donates an electron to vitamin E that can then donate that electron to a reactive oxygen species. Thus, vitamin C, which is found in most yellow, red, and orange fruits and vegetables, is very important to consume with each meal so that you replenish the antioxidants that are being consumed. Vitamin C can also be applied topically to the skin as well. Many of our other antioxidants come from the plant kingdom. Why is that? Well, plants live outdoors and they're able to survive in an oxidative-rich environment. Therefore, as humans, we borrow substances and molecules from the botanical kingdom to put on our skin and to consume to protect us also against reactive oxygen species. So topical antioxidants can supplement sunscreen protection, but do not replace sunscreens. They must be used together. So antioxidants can be thought of as protecting against the damaging effects of solar radiation when that solar radiation was not stopped by sunscreen. But antioxidants can also have benefits against other oxidative stresses, such as air pollution, ionizing radiation, smoking, and endogenous metabolism. All of these reactive oxygen species basically result in DNA damage, a topic that we're going to come back to and address in a few minutes. Now, antioxidants are necessary. This is a really nice review by Dr. Wang that was published in the Journal of the American Academy of Dermatology. He purported that broad-spectrum UV protection only reduces the formation of free radicals by 55%. What happens to the other 45%? Well, this is where antioxidants come in. Thus, topical delivery of antioxidants can provide additional benefit to complement the protection from UV filters by providing additional protection to neutralize the reactive oxygen species from both endogenous and exogenous sources. So endogenous sources is really the process of metabolism. Reactive oxygen species are made available and produced by the body just through the process of digestion. Reactive oxygen species are also produced when we make hormones that run our bodies. So those are endogenous, and that's endogenous aging, also known as intrinsic aging. So we consume antioxidants for that. One of the substances that can be effectively used as an oral antioxidant is Polypodium leucotomus extract. In addition, products can be placed on the skin surface as well to augment those that are consumed. But internal and external antioxidant protection is important to prevent both intrinsic and extrinsic aging. Now let's talk a little bit about DNA repair. Remember that DNA repair is the final result of oxygen damage to the body. So reactive oxygen species basically enter the body. They result in cyclobutane pyrimidine dimers and guanine oxidation. It is these two inflammation producing effects where DNA is damaged that result in aging. So reactive oxygen species are pro-inflammatory. They activate the immune system, but they also chop holes in our DNA, meaning that the recipe that is used to produce substances in the body, such as the skin, is no longer youthful or correct. So damage from UV to the DNA results in a recipe for making substandard skin, which is why we see wrinkles and dyspigmentation developing over time. DNA repair agents, on the other hand, can enhance the body's natural DNA repair process. Enzymes such as endonuclease, photolyase, and glycosylase. Plant extracts and vitamins can also provide protection, such as polypodium leucotomus extract, also known as fern block, and niacinamide. While DNA repair is not 100% yet, we still know that skin cancers do occur. DNA repair can be important not only in the prevention of skin cancers, but also in the restoration of youthful-looking skin. Thus, DNA repair, in addition to photoprotection from sunscreens, as well as antioxidants, is really important. It's the base, it's the foundation of our skin health pyramid. Now, pollution has also become something where we've become aware that this can be very, very damaging. Wonderful double-blind studies have been done looking at the same people, for example, who lived in rural Mexico or who lived in Mexico City. Those people that lived in Mexico City, a very pollution-rich environment, showed increased dyspigmentation and increased wrinkling of the face, as opposed to their counterparts that lived in a more rural environment away from pollution. Car exhaust and industrial emissions, as well as tobacco, are all combustion products. Burning is involved somewhere in the process. Through the burning process, little tiny, highly reactive nanoparticles are formed, and these nanoparticles then sit on our skin surface. So pollution can damage the skin by altering the skin barrier, producing reactive oxygen species, which results in inflammation, and activating aryl hydrocarbons, leading to DNA damage and alteration to the cell. The aryl hydrocarbons are the carcinogenic part of what comes out of car exhaust. Thus, if the DNA damage does not occur, we have alterations to cell morphology, we have degradation of the extracellular membrane, and hyperpigmentation. One way to effectively protect yourself against pigmentation through the use of cosmetic products is to apply a film over the surface so that the highly reactive nanoparticle resides on the skin instead of in contact with the skin. Thus, sunscreens, moisturizers, facial foundations, anything that provides a protective covering over the skin surface can offer excellent, effective protection against pollution. In addition to that, biologic cellular protection is also possible through the use of an organism known as Decampsia antarctica, which also inhibits the AHR activation. So externally, through the use of film-forming products, and internally, or in addition, topically, we use organisms that live in very difficult to survive environments that have excellent antioxidant potential and capabilities, such as Decampsia antarctica. And these organisms can then be put on the body to provide protection. So the pyramid base has to encompass not only protection from reactive oxygen species from sunlight, but also from pollution. Now, in addition to topical products, we can also take oral supplements as well. Oral supplementation is becoming more popular through the use of vitamins and vitamin supplements. Sun protection, antioxidant, and DNA repair activities can be complemented nicely by oral supplementation. These would be vitamin derivatives, such as the carotenoids, that would be the vitamin A's, nicotinamide, vitamin C and vitamin E that we've just talked about as being very important protective antioxidant vitamins, and also vitamin D. Dietary non-botanicals can also be consumed in the form of polyunsaturated fatty acids, probiotics, and edibonone. And other dietary botanicals can be consumed just before going outside or on a daily basis, such as fern block, green tea, and resveratrol. Thus, you can nicely complement the base of the protective pyramid, not only through topicals, but also through orals. And certainly orals is an area in dermatology where we need more research. There's a lot yet to be learned in this area about what the optimal diet and what the optimal supplementation should be. So at the bottom, we've covered protection. We've covered the use of sunscreens. We've covered the use of antioxidants and actives to protect and repair the skin. Now we're at the middle of the pyramid. This is the renewal part of the pyramid, which is focused on exfoliation and retinization of the skin. Both of these ingredients being put into the moisturizer chassis that we discussed earlier. Now in the pyramid middle, exfoliation is very important because as you exfoliate the skin that should have desquamated but didn't, you get more youthful skin that has not yet seen the sun. Certainly if you over exfoliate, you can damage the skin and create sensitive, itchy, burny, stingy skin. Thus, the use of exfoliants must be done carefully. The most popular exfoliants in the marketplace are the alpha hydroxy acids, also known as AHAs. These include acids such as glycolic acid, lactic acid, and malic acid. Glycolic acid from sugarcane, lactic acid from milk, malic acid from apples. These are fermentation products. However, in order for alpha hydroxy acids to be active, the pH of the product has to be somewhere between a pH of 2, 2.2, 2.4. What then happens is the alpha hydroxy acids induce exfoliation by interrupting the ionic bonds between the corneocytes. Also, they induce hydration of the skin. As we get older, the enzymes of desquamation don't work as well, partly because there's not enough water, and these enzymes do require water in order to function. So alpha hydroxy acids plus moisturizers can renew skin exfoliation, creating a smoother skin surface. But again, you have to be very careful to exercise care when using these low-grade irritants. Also in our pyramid middle are retinoids. Retinoids are very important because we have retinoid receptors in the skin, and this is one of the few places where we can get receptor-mediated renewal of the skin itself. Retinoids that are prescription for anti-aging purposes include tretinoin and tazarotene. And we also have over-the-counter counterparts known as retinol and retinaldehyde. Retinoids are very important in the anti-aging armamentarium. They can induce thickening of the epidermis. They can increase the height of the reedy ridges. They can normalize melanocyte function and increase dermal fibroblast. All of these are activities that go astray in aging skin, but can be restored through retinoids. Retinoid receptors that are present in the skin surface account for their enhanced efficacy. But unfortunately, retinoids too can be very irritating, just like the alpha hydroxy acids, because in order to activate the retinoid receptor, irritation occurs concomitantly. Usually retinization of the face can occur over 4 weeks, but it's also possible if in the anti-aging over-the-counter armamentarium to pick retinoids that are less irritating. Retinoids are the gold standard and have been for many years, but because they have many side effects, especially skin irritation, it's difficult to get patients to adhere to a retinoid regimen. However, retinoids can be introduced slowly over time, using them every other day for a couple of weeks, then using them every day for a couple of weeks. And as you increase the application, you become accustomed to the retinoid on the skin surface, and that is a process known as facial retinization. Now, there are some better tolerated retinoids in the marketplace that can be used in the cosmeceutical arena, and one of these is hydroxypinocolone retinoate. This hydroxypinocolone retinoate specifically acts on retinoid receptors that are the alpha, beta, and gamma, which are all 3 of the retinoid receptors. By activating all 3, it produces better retinization effects. Retinol can also be used, but unfortunately concentrations of retinol above 2% can be very irritating. Thus, if you put retinol in an altered time-release delivery system, you can still get the benefits of retinoid receptor activation, but minimize the retinization side effects that cause irritation. So putting retinol in delivery systems that include microsponges and glycospheres can improve retinol penetration and also improve retinoid stability. Because remember, retinoids are both degraded by light and by oxygen. So stability is critically important. But more importantly, the microspheres and the microsponges can gradually release the retinoid into the skin so it doesn't see such a large initial dose. Thus, you get sustained release and sustained action with greater tolerability. So some of the more novel retinol delivery systems have allowed people with very sensitive skin to get the anti-aging benefits of retinol. Now, these are the various forms and the active forms of retinoids. Retinyl esters are commonly used in skincare products because they're very stable and less irritating, but notice that their potency is not so good. The newer HPR formulations have also high stability but better potency, which is why this particular category of ingredients is important in the market. Retinol has moderate stability and medium potency, and it has low irritation potential, especially put into a time-release delivery system. Retinaldehyde has low stability, very high irritation potential, and of course, retinoic acid, better known as tretinoin, of course, is the most irritating. Fortunately, these retinoids can be converted. For example, retinol esters in HPR can be converted to retinol, which is converted to retinaldehyde, which is then converted to retinoic acid. So the skin is metabolically active. Therefore, all of these retinoids can eventually be converted into the highly active retinoic acid, but only in small quantities. Retinol definitely has better tolerability than retinoic acid, and that's the reason why it's used in many over-the-counter formulations, in addition to retinol being a vitamin, so it can be used without prescription. Thus, there are many retinoid active forms that interconvert and have different relationships between their potency, their stability, and their potential irritation. So now we finished talking about the middle of the triangle. We've talked about the renewal, the retinoids. We've talked about the alpha hydroxy acids. Now let's talk about activation and regeneration, things to induce firming, things that repair the damage that's induced by procedures. And finally, alternatives for individuals that have skin too sensitive for alpha hydroxy acids and retinoids. Here we have peptides at the top of the pyramid. We have three peptide classes: your carrier peptides, your signal peptides, and your neurotransmitter peptides. Your carrier peptides are substances that are designed to take another active ingredient into the skin. It's not the peptide itself that's the active agent. Most of the carrier peptides on the marketplace today carry copper, an important ingredient for wound healing. But the peptides themselves do not offer the wound healing benefit. It is the copper. So these are basically vehicles to get the peptide or the active ingredient to the skin surface. Signal peptides have a much larger role to play in the current cosmeceutical environment. The most popular one is a fragment of procollagen 1 that is thought in vitro to stimulate the production of collagens 1, 3, and 4. It's used in very small quantities of 4 parts per million, thus acting as a signal to induce cascading events downstream that hopefully result in the production of more collagen through a reduction in the activity of collagenase. Thus, signal peptides are thought to increase glycosaminoglycans, collagen, elastin, and fibronectin. Finally, we have the neurotransmitter peptides, which are supposed to mimic the toxins, botulinum toxins. These are designed to interrupt the neuromuscular junction signal. Thus, the neurotransmitter peptide acetylhexapeptide 3 mimics the N-terminal end of the SNAP25 protein inhibiting snare complex formation, the same thing as botulinum toxin. However, injections are much more effective than topical application. Now, also at the top of the pyramid are growth factors and cytokines. The most commonly growth factors used in cosmeceuticals are transforming growth factor beta 1, or TGF beta 1, that induces keratinocyte migration, EGF, or epidermal growth factor, that induces epidermal proliferation, platelet-derived growth factor, PDGF, which induces macrophage activation, and fibroblast growth factor, FGF, such as the activity created by Cryptomphalis aspersa, which induces fibroblast proliferation and migration. Thus, growth factors and cytokines have become very important in dermatology. The idea is that these growth factors will take older skin and by restoring the growth factors, create a reason why they should behave like younger skin. In other words, you're reprogramming the skin. These can be done with a variety of different growth factors, such as those derived from neonatal foreskins, but also from the mollusk Cryptomphalis aspersa. These can cause keratinocyte migration and epidermal regeneration. And the growth factors from the mollusks can actually have an effect in the treatment of photoaging. Thus, we can also get fibroblast activation and proliferation, resulting in dermal regeneration. So growth factors are a rapidly expanding area, and growth factors can be derived from several different things. One example is they can come from conditioned media. So here we see a bioreactor in which fibroblasts are placed. The media is put into this mixing vat where oxygen and nutrients are placed. And once the fibroblasts become confluent, the effluent is taken off, which is the stem cell conditioned media. And this stem cell conditioned media is then put in the cosmeceutical product. Stem cell derivatives can come from either plant or animal origin. But one example of an important ingredient is Cryptomphalis aspersa, which is interestingly a snail egg extract. I actually did some clinical studies on this particular ingredient. And this ingredient in vitro can improve stem cell migration and differentiation. It can promote extracellular matrix formation, improve cell adhesion, improve migration of epidermal keratinocytes and dermal fibroblasts. I did a clinical study where we enrolled 40 subjects, 36 females and 4 males, ages 40 to 70 years of age with photoaging. The subjects applied the products twice daily for a total of 3 months. Indeed, what we found in the results that there was a 13% reduction in eye wrinkles, a 10% reduction in forehead wrinkles, a 53% reduction in skin roughness, a 26% improvement in skin brightness, and a 39% improvement in skin elasticity. Thus, we were able to take the in vitro findings and confirm them with an in vivo clinical study. These are some of the pictures from that particular study. And here you can see the baseline photo is on the left and the 12-week treatment photo is on the right. And here you see softening of the nasolabial fold. Here again, we have the baseline photo on the left, the 12-week photo on the right. And here you can see some minimization of the marionette lines around the corner of the mouth. And finally, looking around the eye area, what we see in the frames to the left is decreased wrinkling around the eye from baseline to 12 weeks through enhanced moisturization and antioxidants. As well as in the lower photo, you also see a reduction and softening of the crow's feet and reduced fine lines. Thus, now we have observational data, we have photographic documentation of the original in vitro findings for the mollusk extract. So in summary, what can we say about the skin health and beauty pyramid? Well, we can say that here we have organized the products that are currently available and the technologies that are currently available for anti-aging into 3 strata that form a pyramid. Protection, the place you have to start, with sunscreens, antioxidants, and actives to protect and repair. That's the basis. Once you've instituted that, then you can go to the middle layer of the pyramid, which is renewal, the use of retinoids, alpha hydroxy acids in moisturizing vehicles. This would be the next layer of products that you would introduce to your patients. And then finally, the activation and regeneration. Once patients have become comfortable with the renewal, you move on to the top of the pyramid, the use of peptides, growth factors, and stem cells. By thinking about skincare in terms of the bottom pyramid protection, the middle pyramid renewal, and the top pyramid activation and regeneration, you can help patients to understand the importance of using multiple products sequentially. You can also identify at which level of the pyramid the patient is and know what the next level is for their return visit to the office. You can also help them organize your skincare recommendations, and you can help them understand how to properly apply their products. Thus, I hope that the skin health and beauty pyramid will be useful to you in your clinical practice. Thank you very much for your kind attention, and I now would like to take any questions you may have.
Thanks, Dr. Draelos. After your excellent presentation, we can see that the Skin Health and Beauty Pyramid offered us a new strategy to carry out the anti-aging treatment algorithm. And without that, it will be of a great value in planning the anti-aging treatment for our patients. I think that we can start with the question and answers. James.
Yeah, okay. Some questions have come in during your presentation, Dr. Draelos. Of course, everybody is welcome to continue sending questions as the conversation moves on. The first question is it important to always act on all three levels of the pyramid?
Well, the pyramid is designed so that you start with the bottom and work your way up. It's too much to introduce all the products at one time and not necessarily required. So start with the bottom level because that's the basis, SPF, sun protection, then go to the middle level, then go to the top level. So I would advise that it's done sequentially for each of your patients. And that way you can make adjustments at each level before you proceed to the next.
Yes, James, I have another question for Dr. Draelos. This question is about a patient with moderate to severe aging and significant loss of firmness. The doctor asked about what would be the ideal treatment based on the pyramid.
So the pyramid for discoloration and dyspigmentation is on two levels. The most basic is you need to have SPF, you need to have photo protection, you need to stop the UV radiation that's driving that pigmentation. Then on the top level, where we're at the regeneration level, that's where you then would provide your cosmeceutical products or your pharmaceutical products designed to lighten skin. So the pyramid is basically to go from the base up to the top, continuing to add products, but pigmentation fits in protection. Pigmentation also fits in regeneration.
Okay, thank you. We have another question that said, what should be taken into consideration when applying the pyramid to different ethnic skin types? I think that is very interesting. Try to apply the pyramid to the different ethnic skin types. What do you think?
Well, the pyramid is designed to address all the Fitzpatrick skin types. It is not skin type specific. The three basic levels of the pyramid are pertinent to all skin colors, all levels of photosensitivity. And that's the beauty of the pyramid, is that it's generalizable. It can work on males and females. It can work on young and old. It can work on Fitzpatrick 1 all the way through Fitzpatrick 6. It's one pyramid that addresses really universal skin needs.
Okay, good. A question from Italy. In heavily polluted urban areas, what's the priority? Sun protection or protection from pollution?
Well, it's interesting that sun protection and pollution protection go hand in hand. Pollution, especially from internal combustion, that would be burning like automobile engines and factories, contains nanoparticles. And when those nanoparticles touch the skin, that's when the reactive oxygen species get generated. However, if you put a sunscreen on your skin, not only do you get sun protection, but those nanoparticles get lodged in the sunscreen film and do not touch the skin. So they're really one and the same. You can wear a sunscreen that is a cream that creates a film on the face that protects from pollution.
I have a question from Leila that she is asking you, what ingredients do you want to be included in a moisturizer for patients with oily skin and acne patients?
Well, many people that have oily skin wash with a very strong cleanser and they get a little bit dry afterwards, or they're using acne medications such as retinoids that dry out their face. So in that case, you just need something to smooth down skin scale. And that basically would be an oil-free moisturizer based on silicone derivatives or dimethicone. So oil means mineral oil, petrolatum, sunflower oil, hemp oil. So you do not want to use those, but oil-free products that contain dimethicone are non-comedogenic, non-acnegenic. They smooth down the skin scale and they do not cause acne. So that is the perfect ingredient, dimethicone, for an oil-free moisturizer for acne-prone patients.
Okay, good. At what age do you recommend to add retinoids to the skincare routine?
Well, retinoids are kind of a universal product as well. You know, they can be used in youth for acne treatment because they normalize follicular keratinization. But I think retinoids need to be started based on the needs of the patient, how much photoaging they have, and how much they are engaged in the protection process. So I think you can start retinoids at any age. We have a variety of retinoids to choose from. We have tretinoin, we have tazarotene. So I think you can actually start retinoids in youth for acne and continue them all the way through maturity. Many of the over-the-counter retinols are suitable for all individuals of all ages and can be easily started as part of the beauty pyramid.
Okay. Often photoaging is characterized by spot and hyperpigmentation. Where does this fit into the pyramid? What would the ideal treatment protocol be?
Well, as I mentioned earlier, photoprotection is the basis. So you need to use a broad spectrum sunscreen that protects against UVB, UVA, visible light, as well as infrared. Then what you need to do is you need to use some type of anti-aging regimen. This can include the use of topical tranexamic acid, topical arbutin. Deoxyarbutin is probably the most effective, one of the most effective skin lightening agents. Usually you have to come at pigmentation from many different modalities. So pigment lightening first is not to make it worse, protect yourself from the sun, and then to select a variety of topical agents that are most effective. So that can be pulp mulberry extract, retinol topically, OTC also helps with pigmentation. And if you wish, you can use a prescription product as well after starting with your over-the-counter products, which should be used with prescription products, because once you stop the prescription product, you need to have a maintenance routine, and that maintenance routine should be over-the-counter products.
Okay, good. Thank you. Do we need to apply the beauty pyramid for all ages, or are there different focuses according to the different age groups?
No, I think the beauty pyramid is for all ages. However, for someone 15, 16, 17, 18, really the bottom of the pyramid is what you will administer, photo protection, SPF, but you may not need to go to the higher levels. And so the 3 levels of the pyramid are designed for all ages, but it may be that your patient doesn't need the upper 2 levels and you can start at the bottom at age 18, but by the time they get to 40, they may want to start to advance up the pyramid. So the pyramid is generalizable enough that you can go as many levels as are required for each individual of each age.
We have a very interesting question from Australia. What is your preferred ingredient to protect the skin against visible blue light?
Well, visible blue light is a big challenge, and certainly that is a phenomenon of the modern digital age. So sunscreens are not really good at protecting against visible light if they're of the organic type, whereby a photon of UV radiation strikes the sunscreen undergoes a chemical reaction that absorbs the energy from the solar radiation. For blue light, it needs to actually be a physical block. So that could be iron oxide, for example, and many of your facial foundations contain iron oxide as a pigment, and that pigment will block blue light. You also can get some photoprotection from the inorganic sunscreens, which is titanium dioxide and zinc oxide. Of course, these can leave a white film on the skin, so they do need to be tinted, and they're not appropriate for all Fitzpatrick skin types unless appropriately tinted. But basically, the combination of a sunscreen with a facial foundation, a cosmetic, can offer excellent protection against blue light.
Okay.
Okay. A question now about combining procedures, anti-aging procedures, with the cosmetic products that you discuss in your pyramid. The question is how can procedures be introduced into the pyramid? Things like laser, microneedling.
Well, the pyramid is designed so that you can use it with all procedures. As a matter of fact, it's essential you use the pyramid with all procedures to optimize the outcome. So before the procedure is undertaken, you need to institute the bottom, which is excellent moisturization, and that's necessary to provide an environment for healing post-procedure. You also need to have sunscreen, because otherwise you could see an increase in post-inflammatory hyperpigmentation. So the bottom of the pyramid you would institute prior to the procedure. Then you could institute your procedures, and then you can add the other layers of the pyramid as you see fit, depending upon the procedure itself. But the pyramid is designed to optimize the outcome of any rejuvenative procedure. It is not procedure specific. So you can follow that pyramid, whether it's laser resurfacing, or whether it's microneedling, or whether it's chemical peeling.
Yes, one question, Dr. Zoe Draelos. In the top of the pyramid, we have the regeneration of the skin. We can induce, for example, with Krypton phallus aspersa secretion, we can induce a faster regeneration after procedures. We can add in the pyramid these uses, no? After 2 procedures to try to regenerate the skin faster and well, okay. No?
Yes, definitely. At the top of the pyramid are the growth factors and the peptides, and those definitely can heal post-procedure. And so you want to pick products that you feel are safe to use post-procedure that fit into that category. But regeneration and healing are not only part of the post-procedure world, they're also part of everyday life. So those products would be used on a daily basis, but perhaps you might want to use them more frequently or add additional products post-procedure.
Thank you. Thank you.
Where do DNA repair enzymes and cytoins fit into the pyramid?
Well, DNA repair enzymes are important to repair damage. And so when you apply photoprotection, unfortunately, the sunscreens do not get every single photon of energy that strikes the skin. So people have started using antioxidants in skincare products to try and neutralize those reactive oxygen species that are still produced despite wearing a sunscreen. Because, you know, it's very hard to get an even film. It's very hard not to have any skip areas. It's very hard to keep the sunscreen in place when you sweat and you wipe your brow, you're wiping the sunscreen off. So you do need sunscreen and antioxidants. But there are still photons of radiation that even get through the photoprotective film and the antioxidants. And that's where DNA repair comes in, because now you have DNA that's been damaged by reactive oxygen species, and you need to promote repair of that DNA to prevent photoaging. So it's like the next step after sunscreens, antioxidants, then we have DNA repair.
We have another very interesting question. Dr. Draelos, what do you think to add oral photoprotection to the topical protection?
Yes, there are oral ingredients such as Polypodium leucotomus that can act as internal antioxidants. It's important to remember that the 2 antioxidants in the skin are vitamin E, the primary antioxidant, vitamin C, the secondary antioxidant. So you need to continually consume fruits and vegetables rich in vitamin C. They're usually colored orange, yellow, and red. And then, of course, vitamin E can be taken in the form of a supplement as well. But it may be worthwhile before you go out into the sun to take additional oral antioxidants. And the one that's currently on the market is Polypodium leucotomus, and that may be worthwhile for many people to ingest.
Yes, yes. Thank you. There are any questions, James?
Yes, a question about how many hours of sunlight can chemical sunscreens absorb before becoming unstable? So I guess the question is, how often should sun protection be reapplied to ensure that it's effective?
With your traditional sunscreen that has filters beyond zinc oxide and titanium dioxide, each photon damages one molecule of sunscreen. But the sunscreen does get used up more by being sweated away or by the film being disrupted. So we generally say that people should apply their sunscreen every 2 hours when outdoors. And this will provide adequate photo protection.
Okay.
There is a question in French. James, do you translate it?
Yes, we've already done that one, Maria. It was about the procedures, how the procedures fit into the pyramid.
Yes, and there are a question here. No, it's the same. To use the firm block as oral photo protection against the visible light. Yes, is that comment Dr. Draelos before? Okay.
Yes, Firm Block is an excellent product that you can use to provide oral photo protection. And this is an area of a lot of research where people are looking at oral substances that could boost photo protection, because theoretically you could get better distribution. No skip areas, it doesn't wash off, it's not sticky, it doesn't make a mess out of your makeup. And so oral photo protection really is becoming a much more important part of dermatologic photo protection. Absolutely.
Sure, sure.
Okay, and Maria, there is another question in French. You're right, maybe I hadn't seen it. This is Dr. Draelos. Can the pyramid be used all year long, or are there certain precautions or changes one should make as you move towards the summer and there's more sun exposure, the sun intensity is stronger? I think about retinoids and the middle layer.
Sure. Well, the pyramid can be used year round, and certainly retinoids are photosensitive and can increase photosensitivity of the skin. Therefore, it's important to wear a good sunscreen. So I think the concept of the pyramid works year round. However, you may wish to customize your products with the 4 seasons of the year. At the bottom, heavier moisturizers in the winter, for example, when the humidity is low. And then in the summer, increase SPF sunscreens that are maybe water resistant that you're going to wear on your body in the summer. So the pyramid concept remains the same, but the environment in which your skin is placed will change with the seasons, and therefore your products need to be reconsidered as well.
Okay, and probably time for one last question. This is about vitamin C. Is it best used in the morning or at night, in your opinion?
I would use vitamin C at night. And the reason is that during the day, vitamin C, remember, is a very photosensitive vitamin as well as a oxygen sensitive vitamin. So your antioxidants that are light sensitive are best applied at night. So during the morning, you want to focus on photoprotection, you want to focus on moisturization, and then at night, you will not need your photo protection. There you add your cosmeceutical treatment products and of course a moisturizer that maybe would be a little bit heavier since you're going to be wearing it, not under makeup. And remember that the body repairs at night, does not repair during the day. So during the day, energy is used for speaking, thinking, walking, talking. At night, when the body's at rest, that's when the skin repairs for the next day. So using products in the evening makes a lot of sense.
It's very clear. During the day, we needed to protect from the environmental, protect the sun radiation, and protect from the contamination, the environmental pollution, no?
Correct.
Yes, with the new technologies like EDAFENS too. Thank you, and I am think that the time is over right now, and I like to say thank you, Dr. Draelos, for your excellent presentation, for your excellent work. Okay?
Thank you very much.
Right. Okay. There have been a lot of questions, and I think the answers have been very interesting. They've been as interesting as your presentation. So maybe we'll make a transcript of them all and send them to the people afterwards, maybe with some answers to some of the questions that we didn't get around to. And so, as Maria said, thank you very much on behalf of Cantabria Labs for your presentation, for the discussion. It was very interesting, a lot of questions, and I think it's given us some very useful ideas and tips for developing optimal anti-aging treatments for our patients. So thank you again. Thank you, Maria, for having been with us today as well. And thank you to all of you, the participants who have tuned in for the webinar for the In Touch Cantabria Labs session. We hope to see you again very shortly in our next session. And just before closing off, I'd like to comment that the article containing the revisitation or the updating of Dr. Draelos' pyramid will be published in the June edition of the Journal of Drugs in Dermatology. It will be available as an open access, so it can be freely downloaded and shared, but we will also be sending you all a copy of the publication when it becomes available. This will be in June, and so I think it will be a nice complement to the presentation that we've seen this morning, this afternoon, or this evening. Once again, thank you very much, and hope to see you soon, and have a good rest of the day.